This condition I'll be talking about today is the most reason why most women lose their life on the course of 9 months journey, that is the pregnancy journey and that of their baby. This is iron deficiency anemia or anemia at large. Anemia is most leading cause of complications and death in pregnant women. Let's dive into that proper in today's video. Anemia during pregnancy is a common condition where a pregnant woman has a lower than normal red blood cell or hemoglobin. It can be caused by various factors, including if when there is deficiency in iron, when there is deficiency in folic acid or vitamin B12. What are the causes? Let me explain proper. Iron deficiency is the number one cause of anemia. When the most common cause is iron deficiency, and it occurs when the body does not have enough iron to produce hemoglobin. You know, hemoglobin has an iron pigment which helps to carry oxygen around the body. But when this iron is produced less, hemoglobin cannot be produced. Then this is due to increased demand of iron during pregnancy for the growing fetus and the placenta. That's why we advise women to always take their rich iron prenatal vitamins. Then the next one is folic acid deficiency. This is essential for your red blood cell production. A deficiency can lead to megaloblastic anemia. That is when the body produces large or abnormal blood cell. When they are assuming the blood cell is like this and the body is producing a blood cell that is large, it is as a result of folic acid deficiency. And you know that folic acid helps to prevent congenital abnormalities. So that is your response to always take your prenatal vitamins. The next one is vitamin B12 deficiency. This is less common but important. When you have vitamin B12 deficiencies, can also result in that type of megaloblastic anemia that I just explained. The next one, increased blood volume. During pregnancy, the blood volume increases, diluting the red blood cell and leading to physiological anemia. That is more water but less components. That's what it means. That is, you have less blood cell but large blood volume. That's another type of anemia. Then what are the symptoms you experience in pregnancy and you know is as a result of anemia? You always fatigue and you are always weak, you are pale, you have a yellow skin, you are always fighting for your breath, you cannot breathe well, you are dizzy, you are having lightheadedness, you are having irregular or heart palpitation, you also have cold hands and feet, recurrent headache that is not associated with your BP or dehydration or malaria and the rest of them, then they should also suspect anemia. Then when you have this anemia, what is the risk can it pose on your baby? It will make you to deliver premature. You have a premature birth, your baby will be low weight, you have postpartum depression, your baby will be having some developmental delays and also increased risk of infection. So that is what anemia does to a pregnant woman. So how can you diagnose or know whether you have anemia? You do a routine blood test during prenatal visit. That is when you come for your prenatal visit, they will do a complete blood count or full blood count to measure your hemoglobin and your blood levels and also hematocrit levels in your body. So how can you treat this condition? By taking iron supplements. Those supplements that are rich in iron, oral iron supplements, are commonly prescribed. So that's why in pregnant routine drug, iron is most vital, and also folic acid. All those things are very vital. That's why they give it to you. And also in most severe cases, when your iron deficiency is low, that it cannot be supplemented by oral, they can give you the one that is given by injection. Then folic acid supplement is also recommended for pregnant women. Then vitamin B12 supplement. All these things are included in that prenatal vitamins you are taking, whether brand or routine drugs that they give in the hospital. They contain those things. So, but it's your responsibility to always take them regularly. Then also, if they find out you have this iron deficiency or any types of anemia in pregnancy, you need dietary changes. You can incorporate more iron rich foods like red meat, you eat green leafy vegetables, beans, then folic acid rich foods like citrus fruit, that is like orange, leafy green, and fortified cereal. Then vitamin B12, if you are deficient in this area, they can ask you to eat more meat and dairy, that is milk and eggs. Then how do you prevent yourself from coming down with any type of anemia? So how can you prevent anemia generally? By always taking your prenatal visit, eat balanced diet, and don't miss your prenatal visit. That is, in your prenatal visit, they will be checking you to make sure that you are okay throughout the pregnancy. If this video has added value to you, don't forget to like this video, comment on this video, and share to your loved ones. And see you in my next video for more educational content.